Now, from the News Channel 5 network, this is Medical Mondays.
Good evening, everyone. Welcome to Medical Monday. I'm Carrie Sharp, joined by Dr. John today, a pulmonologist and sleep disorder expert. Boy, do we need to talk to him, and I speak for everyone, I think, today. Thank you for being with us, Dr. John.
Thank you for having me.
Your practice is out at St. Thomas Midtown. Also, we should mention a satellite clinic in Lincoln County, so you're a little bit spread out, serving lots of folks. And sleep disorders is part of your practice, and you're saying you're seeing quite the uptick in folks coming through that door. Why is it?
Well, people are not sleeping well these days. Everybody's on their phone, and then when they hit the bed, they want to go to sleep.
Yeah.
And sleep doesn't work that way.
No, I think we've seen study after study that stimulation is hard to turn off so quickly, right?
The light from the cell phone is very powerful, and that when that reaches the brain, that's a cue to be awake. And that's why we wake up in the morning, because the sun hits the eyes, and so all the powerful light hitting the eyes, and the brain is thinking you're awake, and you're thinking you want to go to sleep, and it doesn't happen.
And it can lead to things like insomnia, right? Which we're going to talk about today. Also, we're going to talk about sleep apnea, restless leg syndrome, snoring. So many people are either a snorer or they sleep next to a snorer. It can really cause a lot of disturbance. If you have questions about any of these things, anything that deals with sleep, go ahead and give us a call tonight. 615-737-PLUS is the number to call. Go ahead and get those calls lined up. Don't be afraid to call in. This is your chance to ask an expert for free. You can't beat that when it comes to medical world these days. So go ahead and give us a call for Medical Monday tonight. In the meantime, I get to ask the questions, which I'm excited about. Let's just start with the very basic. How much sleep should we be getting?
There's not a fixed number. Some people sleep 4 hours and they're fine. It all depends how well do you do the next day. But roughly you need about 6 to 8 hours.
An adult?
Correct. Some need 6, some need 7. Some people do need 8 hours of sleep.
So what are the factors you should be judging on that the next day?
How well are you able to function? When you wake up in the morning, are you ready to go to work or to school? Do you have the energy, or are you hitting the snooze button? If you're tired, you just don't have the energy, then number one is not sleeping too much. Or are there other disorders like sleep apnea, restless legs? And those are the things we need to ask ourselves, why are you doing that?
Now, I've heard of different phases of sleep, like REM sleep.
Sure.
Tell me about that. Give me the doctor's perspective on that.
There are two types of sleep, REM sleep and non-REM sleep. REM, the word REM means rapid eye movement. So during that phase, your eyes are rolling. And your body is a little twitching. You can see that in dogs, if you watch dogs or pets sleep. That's when a lot of dreaming happens. The non-REM sleep has got 3 stages, 1, 2, and 3. So you enter sleep through non-REM sleep, and then you go into REM sleep, approximately about 90 minutes into sleep. And this cycle repeats. So there are shifting changes throughout the night.
So you go in and out of that REM sleep?
Yes.
And is it safe to assume that in that REM sleep, that's your deep sleep?
That's a misconception.
Oh.
REM sleep is essential, but that's not the deep sleep. N3 or stage 3 sleep of the non-REM is the most sweetest sleep.
Really?
REM is essential. That's when you dream. You kind of resolve all the conflicts of your life. That's when things you want to say to people you cannot say.
Really?
That's like that much needed for your emotional development.
Okay.
Or stability, I would say. So it's needed, but it's not it's not a restful sleep. You are kind of, how do you describe REM is your mind is awake, but the body is quiet.
I understand that, because sometimes I feel like I have these conversations and I'm figuring things out, and it's very vivid, but I know I'm asleep.
Correct.
So that's REM.
Therapy for you in your sleep.
Yes, it is. It's cheap therapy, isn't it?
Yeah, but the deep sleep, the N3, the sweet sleep, that's what makes you more refreshed. That's what everyone needs to be really to be functioning well.
Do some people have a hard time going through these stages?
Correct.
And what causes that?
Like if you're sleep deprived today, you do sleep tomorrow night, deep sleep. That's when you have the deepest sleep, the sweetest sleep. You compensate. But if you have a lot of worries in your life and you're not doing things, you're a worrier, and then you go spend a lot more time in REM sleep, and then you're not rested. So some people can sleep 8 hours and they feel you feel tired because you spend a lot of time in that restless sleep. And some people sleep a little bit and they are really refreshed.
Wow.
So those are the nuances of sleep.
Let's talk about dreaming.
Correct.
What are these dreams? I mean, do you have to get into a certain stage to do your dreaming? Is that the REM sleep? And why do we dream?
You dream in all sleep stages, in non-REM and REM, but in REM sleep you dream more. So we don't have a clear explanation why we dream. That's been a question that's been asked, but it is essential to dream. I've had people who don't dream, so it is necessary to have those dreams. The beauty of the dreams, you never remember most of the time.
Why is that?
That's how your body's mechanism is. You're done. It's a drama that's plays in your life, and when you wake up, the show is over.
That is very interesting.
Yes.
That is so very interesting. Can you ever catch up on sleep? Let's say I've gone a couple of days getting very little sleep, and then I just crash on the weekends. Can you catch up technically?
Yes, it's a sleep debt. You catch up. You don't need to worry much about it. The point, the more you worry about it, then the more problem that you have. You don't sleep well. You'll catch up. It's sleep debt will catch up with you. So, it's only you can answer, did you have enough sleep, depending on how you feel like the next day.
Well, that's some good news. As a mom of 2 little boys,
Yes.
and one who rarely slept through the night. I mean, he didn't sleep through the night till 22 months old. I thought, I'm never going to catch up on this sleep, so I can.
Yeah, children need a lot more sleep than adults.
Yeah, let's talk about that. How much?
When you're younger, you need about 12, you actually grow in your sleep. You secrete the growth hormone, and it's not a old wife or a grandma's tale that you do grow in your sleep, especially for small children. The growth hormone is secreted maximum during sleep.
Wow.
So that sleep is important.
Can you teach a child? Do you get into this in your practice with children's sleep disorders at all?
I mainly do adults, but I tell adults to train their children, because the children aren't sleeping, the adults are not sleeping.
Exactly right.
So the big thing about children's sleep is the ritual. It has to have more discipline, because children have so much distraction these days. So as a parent, you have to instill discipline in them that you should not be having your computer or phone in your room, no watching TV and the computers. And so you need to have a strict sleep schedule.
Okay, makes total sense. Let's jump right to the phones. We have Nancy on the line. Nancy, good evening. You're our first caller of the night. What's your question?
Yes.
Go ahead.
I would like to know, I've been going to my medical doctor. My oxygen level was staying 97, 96. The last 2 times I've been there, it dropped down to 93. And I'm scheduled to go for a breathing test. But what I'm curious about, what would make it drop so fast?
Well, Nancy, everyone's oxygen does drop a little bit during sleep, because your breathing mechanism is slower. But if people drop their oxygen a little bit lower, like Nancy has, then she might have other conditions. So she's also going for a breathing test. She might have a lung condition. Very common is COPD or emphysema. Those folks lower their oxygen much, much more in sleep. So I think they're doing the right thing by checking a breathing test for her. I do think she might have a COPD or emphysema.
And obviously that's something that's common in smokers, but not everybody who has that, either of those 2 issues, has been a smoker.
Correct. The number one cause for emphysema today is still smoking, and there's a genetic form and that you inherit, but smoking is the number one cause.
But it sounds like Nancy's doing the right thing.
Correct.
Next step is correct. Okay,
Yes.
Good luck to you, Nancy. I hope everything works out okay. Let's get to Vicki on the line. Vicki, go ahead with your question.
Hello?
Hi there, go ahead.
Hi, yes. I was calling about restless legs. I take medicine for it, but I was wondering, do I have to take that medicine every night, or can I just take it when my legs are bothering me?
Restless legs is an interesting phenomenon. It's an awake phenomenon. It usually happens in the evenings. People feel an urge to move their legs, and they get better when they walk, and when they sit down it gets worse. It's a debilitating disorder. You have to take that medicine. The one thing I would recommend, that make sure your iron levels are checked. The low iron is associated with restless legs, and of course B12 and folic acid deficiencies can be associated with restless legs. Make sure that those labs are checked: iron, B12, and folic acid.
Okay, very good. But take it every night. Is that
Correct.
what you're saying?
Yeah.
Okay.
And then if you have low iron, if you treat that and your iron deficiency is resolved, your restless legs will improve.
Ah, very good. Vicki, did you know that
No.
about the iron? Well,
Information.
there you go. Learning something tonight. Good luck. I hope
thank
that
you.
resolves. My father-in-law has the darndest time with that. And it really can. It just keeps you awake.
Correct.
Yeah, and then you're not getting the sleep your body needs. Okay,
Exactly.
we're going to take a quick break. If you have a sleep disorder question, go ahead and give us a call. Dr. Joy is here, or Dr. John is here to answer those questions tonight. We are coming right back for tonight's Medical Monday. Stay with us.
This week on Fishin' Affliction TV.
That's a good one. That's a good one there, boys and girls.
Join us for part 1 of The Big Dog and the Priest as the Big Dog is catching some big bass on J. Percy Priest.
That's a good one. That's more what Daddy ordered.
Your Fishin' Affliction TV weekend begins Saturdays at 5 p.m. right here on News Channel 5 Plus, your home for
Fishin' Affliction.
Joyce, how you feel today?
Oh, my back is killing me.
You take care of getting well. We'll take care of the law part.
Thank you. Thank you for coming.
Dr. Sean Pruitt has spent his career in medicine, dispensing expert advice and helping patients get on the road to recovery. Now Dr. Pruitt is here to help you. Introducing Pharmacist on Call on News Channel 5 Plus. Staying healthy is on everyone's mind. Don't miss your chance to get free advice. Watch Pharmacist on Call with Dr. Sean Pruitt, the first Thursday of every month at 7 p.m. on News Channel 5 Plus.
There's a lot of buzz about the big Hall & Oates concerts this week.
To stay on Talk of the Town, John Oates is here. This Rock and Roll Hall of Famer has lots of stories to tell about the legendary career of this top-selling pop duo in music history.
Then our Meet the Maker series continues with an artist who ships his handmade fire pits all over the world.
Hear how solving a problem for his family gave him a whole new career.
Plus a recipe mashup you're going to love. Miss Daisy's making summer succotash salsa.
Tuesday at 11.
Well, Thomas, you've got pre-diabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have pre-diabetes. Big time.
Hey, did you know 2.4 million loving cats and dogs in shelters and rescues need our help to find a home? Let's go to the shelterpetproject.org and meet a few who are in a shelter near you. Harlow. Oh, she's one great listener who loves to hear all your stories. My kind of cat. Cerulo is a sweet, goofy boy who's eager to please. Sounds just like another dog I know. So go to the shelterpetproject.org, search your local shelters and rescues, and go for a cuddle with your next best friend. Adopt.
Coming up tonight on News Channel 5.
Welcome back to Medical Monday. I'm here with Dr. John, a pulmonologist, I'll get this out, and a sleep medicine specialist. His office is at St. Thomas Midtown, also down in Lincoln County, answering your questions tonight about sleep disorders. Oh, and they can certainly plague us all. We have Ramel on the line who I want to get to right away. Ramel, thank you for waiting. What's your question?
I'm retired military, and I have a sleep apnea.
You can turn down that TV, Ramel, and then just listen to your phone and talk into your phone. That'll help you out a little bit.
And my question is, the sleep apnea just a disability, and I think I sleep better without the machine.
Ah, okay. I'm going to put you on hold so you can listen to your TV now so we can get the answer to that question. First of all, is sleep apnea considered a disability?
Sleep apnea is considered not as a disability, but it is difficult to get insurance when you have the diagnosis of sleep apnea. You know, your insurance premium goes high.
Oh, it does?
Yes, because, you know, it has got a lot of medical issues associated with it. Like you can have heart issues, you can have high blood pressure. So the insurance companies are a little bit afraid. But it is not a qualifier for disability.
Okay.
But Romel needs to wear his mask. He says he sleeps better without the mask, but he can feel better, but he needs to have the mask. If he has been diagnosed with sleep apnea, he needs to absolutely try to wear the mask, or he has to meet with the sleep doctor to find out anything else we can do to...
And we're talking about that CPAP mask, right?
Yes.
That kind of goes over your nose, and it's just over the nose or over the mouth too?
There are 3 different, masks. One that fits on the nose, one that covers the nose and the face, and then one is called a nasal pillow, just like a tubing that goes across the nose. So people tend to prefer the tubing. But if you're a mouth breather, you have a problem. You open your mouth, you need the full face mask that covers the nose and the mouth.
Okay, so you may have some options to switch it up a little bit if something's very uncomfortable.
Yes.
When you talk to your patients about this, is it something that people tend to get used to the more they use it?
Correct. It's like anything else. It's like wearing a new shoe. It takes a while to get it fitted. I tell people just try for a month and make sure that the follow-up is so important. The number one cause is a not fitting mask. So once you resolve that, your compliance gets much better. So the key is to follow up with the sleep physician or the physician that who ordered the machine.
Okay, let's walk this conversation back on sleep apnea. Let's start from the very beginning.
Yes.
Someone comes into your office, they're not sleeping. Why would you expect it or suspect that it would be sleep apnea as the culprit?
Everybody calls and says they either snore or they're tired. That's 2 complaints to the sleep clinic. So the number one cause for being tired is, the most important thing is, the questions will be, are you sleeping enough? If they don't sleep enough, then you're going to be tired. So that's called insufficient sleep syndrome. So rule number 1, if you are overweight and if you have high blood pressure and then if you snore, then you're likely to have sleep apnea as a cause of your being tired.
What is sleep apnea?
The word apnea means to quit breathing.
Okay.
That happens in your sleep. So there's sleep apnea. And there's a word prior to that, it's called obstructive sleep apnea. So there's obstruction in your throat. That's the cause. So it's a 3-part, obstructive sleep apnea.
And the obstruction can be from what?
It can be from your nose up to the back of your throat. The number one cause is the back of the throat, the pharynx, the way you're built. And of course, if you gain weight, you have more fat deposits, so it narrows the airway, so that causes obstruction. Or in children, mostly it can be like the tonsils and the adenoids.
Yeah, because kids can very much have this.
Correct.
And when you talk about you stop breathing, this can be very serious.
Correct.
You alluded to that because it can lead to more complications.
Correct. So when you quit breathing, the brain and the body senses, hey, we have a problem, and it jerks you up, and you wake up. And that phase, you have a response to the heart. You have tachycardia, and that can create abnormal rhythm called atrial fibrillation. So the stress you put on your cells because you quit breathing, it's not good for you, especially the blood pressure. Your blood pressure should be low at night, but if you have sleep apnea, you're not sleeping well, and the stress level goes up, and so the blood pressure goes up. So that's the number one cause of treatable blood pressure is sleep apnea.
Now when you say you kind of jump start because your body says breathe,
yes.
But still, some people don't realize they're doing this, right? They're still in that kind of...
The spouses, I have recordings by their spouses, and they count, how many seconds, the spouse is, not waking up. And then they just jerk and wake up, and they snore and snort, and then start to take a breath.
Okay, you talked about the obstructive sleep apnea. What about the non-obstructive?
There's a central sleep apnea. That's caused by, if you have a stroke, the brain's not sending the signal to breathe. So that's a little different. It's called central sleep apnea. And so this is obstructive. The more common is the obstructive sleep apnea. And then there's mixed. Some people have combination of both.
Okay, so tell me what the CPAP machine does.
CPAP is positive pressure. The word CPAP means continuous positive airway pressure. It blows air and it acts like a splint. It opens up the airway. So that's the job. You're not breathing oxygen, you're just breathing regular air into the airways.
Is that the only fix?
The other things, if the tonsils are big and if you have obstruction in your nose, you can do surgical. And then there's this TAP device, or the dental device. You can sleep with that, and it actually pulls the tongue forward, and that opens up the back of the throat.
How do patients react to that? Is it something they like?
The CPAP is the gold standard, and if people don't like or they cannot tolerate, I send patients to a special dentist who makes those. They make a mold and they make this device. And then if people have mild sleep apnea, there's a ProVent device. It's a little sticky thing on your nose. It's got a valve on it, and it makes you breathe stronger, and that opens the throat up. And there's a newer device called Aspire that they have a pacemaker that they bury in, and they take the wire to the back of the throat, and it sends signals to open the throat up. That's upcoming, and that could be one of the big things.
Really?
But it's invasive.
Well, how far away is that from happening?
I think it's already here. There are specialized centers and a few ENT doctors who already started doing that.
And what would be the right patient for that?
Who cannot absolutely tolerate CPAP. And the dental device is usually for people who have mild to moderate sleep apnea. They have jaw pain, one of the side effects. So people who cannot tolerate CPAP or the dental device, this is an invasive procedure. So we try to choose those
avoid
patients.
that.
Correct.
Sure, yeah. So if you are not taking care of your sleep apnea, if you don't know you have this, or you're just putting it off, or whatever, what are the long-term repercussions?
Yeah, you can have high blood pressure, and then the complications of high blood pressure. You can have a stroke. That's a big thing, and you can affect your heart, the irregular heart rate. And then some people, remember, the body wakes you up, and that mechanism, in conjunction with so many other disorders, cannot happen. And that's you can hear sometimes in the news, people died in their sleep. So it can be a life-threatening problem in conjunction with so many other disorders. Already if you have heart problem and lung problem, so add to this.
Wow.
So,
interesting.
yes.
Okay. Once you have people kind of figured out on the sleep apnea and they're using the CPAP machine or some other device to help them breathe, what do patients come back in and say a month or two down the road?
All these machines nowadays have a little device or a chip that monitors how they're doing.
Yeah.
So are they compliant? How they're responding? Or the sleep apnea is gone? We pull that out and we study that in our office when they come. The symptoms we look for is, are they getting better? They feel better, and that's the response. And of course, you can see the blood pressure coming down. Down, and also it is also people with uncontrolled diabetes. The stress at night causes the diabetes, the blood sugar to jump up, and so those numbers improve. The most important thing, we ask them the question how they're feeling, and also the spouses are sleeping better because they're not snoring anymore.
Sure.
And sometimes, the spouses now they can't sleep because the husbands are much more quieter. So that could be another problem, but they get over that. So
most patients report good results after a while.
Yeah. Some people feel really better like the next day. Like we on the night we studied, they're like, "What did you put in me? I want that now." So
let's talk about those sleep studies. Let me remind folks, if you have a question about any sleep disorder under the sun, give us a call tonight. Dr. John is answering those questions for you. 615-737-PLUS is the number to call. We have a few lines open, so go ahead and give us a call now. But let me get back to these questions, and let's talk about those sleep studies. Because I said during the break, I know people are hooked up to all those things during a sleep study, and they're in a foreign place. I would assume people are not going to sleep well. But you said quite the opposite.
Yes, that's the common fear of everyone. So we survey people before and after. How do you feel? How do you sleep? 90% of them say actually they slept better.
Really? It just blows my mind.
The reason being they're away from their home. They're not worried about bills. They're not watching too much TV. There's no children bothering them. There's no other things to bother them. So they're in a nice environment, and they sleep actually better.
Their one job is to sleep that night.
Correct. That's it.
That sounds pretty darn good to me. Actually, maybe I should come.
And we have a Tempur-Pedic mattress.
Oh, that's not bad either. All right, we're going to take another quick break. More Medical Monday with Dr. John when we come back. Go ahead and give us a call during the break, 615-737-PLUS.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Hi, everyone. I'm Storm 5 meteorologist Leland Statham. This afternoon, a mix of sun and clouds around the area with temperatures warming up into the mid-upper 70s. But late in the day, more clouds begin to roll in, so more of a mostly cloudy sky for the big Preds party on the plaza this evening. Here's a look at the temperatures for you at this hour, and here's what's happening right now from Nashville International. Your Monday forecast, high just shy of 80 degrees for you today with a wind north-northeast at about 5 to 10. Now at 5 p.m., look for a temp right around 77. When the puck drops in Smashville tonight, look for a mostly cloudy sky and right around 71 degrees. Some of our southern counties could see rain tonight, most of us dry. Rain chance tomorrow, greater chance in the eastern counties than the best chance of rain Tuesday night into Wednesday.
The Leukemia and Lymphoma Society is focused on curing blood cancers. You can help us find those cures by getting involved, having fun, teaming up with family and friends, and by joining one of our fundraising campaigns. Train with Team in Training. Walk to light the night. Sail with the Leukemia Cup Regatta. Become a man or woman of the year, or a student that saves lives. Get involved. Because when you do, you're not only helping blood cancer patients survive, you're helping them live. Join us and help us make someday today.
Welcome back to Medical Monday. Tonight we're talking with Dr. John, a pulmonologist and also a sleep medicine specialist. So if you have a sleep disorder, if you can't sleep at night, go ahead and give us a call. Dr. John will help you figure it out. 615-737-PLUS is the number to call. Let's jump right to the lines. Jenny is on the line with a question. Jenny, good evening. What's your question for Dr. John?
Yes. I've had 3 heart attacks, but about 7 years ago, my doctor prescribed me a CPAP machine because I have sleep apnea. And one night I woke up to my daughter beside my bed crying and screaming, and she said I had been choking for like 5 minutes and she couldn't wake me up. And what had happened, I had a cold and I coughed some phlegm up and it kept blowing it back down my throat. So I haven't used my CPAP machine since because I was worried that it would choke me to death in my sleep. And I was wondering, do they make a CPAP machine that has some kind of alarm on it or that turns it off if something like that happens?
Well, Jenny, that's practical. You know, sometimes patients do have this problem, that the secretions, you know, she had sinus problem. So there's no, you know, you will feel bad and then you'll take it out because you're not having the breathing in, breathing out system working well because of the mucus. But she has to make sure that her problems, the sinus is controlled, especially with the heart problem. She has to wear the CPAP. And you know, sometimes with heart failure you can have fluid buildup in your lungs and that could be a problem. So she has to think, is her heart okay? And if she has the sinus problem, which she mentioned, she needs to take care of that so that she can wear the CPAP much better.
So you're saying if she's not having a sinus problem, hopefully you're over that, right, Jenny?
Yes.
Okay. To get this CPAP machine back on.
Yes.
Yeah.
Yeah, you have to wear it, especially the fact that you're telling me you have heart problem. You know, the CPAP protects the hearts. You know, it gives the heart a break with this pumping mechanism. So make sure your heart's working well too, because if your heart's not working well, you know, you might have fluid buildup, you know, what's called heart failure, and make sure that that's well controlled. And you know, and it's absolutely important with your heart that you wear the CPAP, Jenny.
So what should people like Jenny do if they have a CPAP machine? We have allergy season all the time, or just get sick and is congested. What do you do then?
You know, there are treatment for allergies. I'm sure her doctor will prescribe something to control her symptoms. So
it's important to get right to the doctor when you're fighting that.
Yes, because she has to be compliant with the CPAP.
Okay, Jenny, does that help you out?
Alarm? There's none with an alarm on it, though?
No, Jenny.
Okay. Well, thank you.
All right, thank you, Jenny, for calling. I still feel that anxiety she has. You know, it is scary. And you wonder why wouldn't you wake up if you were choking and...
Yeah, you usually take the machine, you know, the mask out because you're choking. So you take it out and the machine makes that sound. There's no warning alarm. It's going to say it's not, you know, doing its job, but there's no like... you know, the warning symptoms.
But you would have to be a pretty sound sleeper if you're coughing up stuff and it's in the mask or whatever and you're not waking up, right? Yeah. Interesting.
I'm sure, I hope she calls the doctor and takes care of her.
So it's time to get back to the doctor.
Yes.
Okay. And by the way, we're going to give you Dr. John's information if you want to jot that down. Get your pen and paper ready. We'll have that coming up at the end of the show. Let's talk about restless leg syndrome. We talked about it with one of our callers earlier. Tell me a little bit more about it. What causes it to begin with?
You know, there is a receptor, the movement receptor in your brain that is dopamine sensitive. That can have a deficiency. That's why those medicines are dopamine agonists. That receptor is also iron sensitive, like I was saying, so iron is needed for them to, make sure the receptor is working. It's a movement disorder, and also, sometimes the other deficiencies, like I mentioned, can also, the vitamin deficiencies can also cause those people to move the rest.
Yeah, you said there's often a B12, folic acid, iron deficiency in those dealing with restless leg syndrome. How common is that when you have someone in your office and you test them for this? Is it 90% of the time?
No, it's about, I would say about 30 to 40% of the people have deficiencies, but the other 60 are, primary. They're not secondary to another reason. They are primary restless leg syndrome.
Can this be inherited?
Yes, yes. There's very strong correlation that runs in the family.
Is it more male dominant, female dominant? Do you know?
It's there's no sex, predilection, but it is familial. It's a higher incidence if the parents have, the children do have that.
And children can do this. I mean, it's not just adults who have it. I think you often hear about adults saying, I have restless leg.
Yeah, and the beauty of it, sometimes these people also have this problem during their sleep. That's limb movements during sleep. That's a little different. The restless leg is an awake phenomenon. The limb movements happen at night. And there's a strong correlation. If you have restless leg, there's a likelihood you're also restless sleeper in your
Interesting.
Sleep.
So there is medicine, but you say check your vitamins as well. Make sure that you're up to speed on all of that, and that's something that you're going to have to probably take the rest of your life, right?
Yes. And one of the major problems is sometimes they can have its symptoms earlier during the day, and also it can happen in your arms. So there are different variations to that. It depends on how you progress. But hopefully it's just the restless leg and you're done with taking a pill at night.
And you were telling me this can kind of lead into other things.
Correct. There's a likelihood you can have, if you follow these patients for years, you can have Parkinson's.
It's an indicator for that, perhaps.
Yes.
Is that fair to say?
Yes.
Yeah. Okay, so it's something that you definitely want to check out. Just don't think you have to live with it, right?
Yes, that's good treatment and people feel better, and they can carry on their lives.
Very nice. Okay, I'm glad we touched on that. Let's talk about insomnia. I think probably everybody gets this at some point. Is that fair to say?
Yes, more common in women than in men.
Because we worry more?
Yes. You're programmed to be.
You're like, yes, that is the answer, yes.
Because in your sleep clinic, you see, if you take insomnia, 100% of all my patients are women. I never see that in a man. Women are programmed to be worried, and so they are thinking about other things. Insomnia, sleep is like a dimmer. You go to bed, you have to have a ritual. But if you want it to be an on and off, you want to do this and then you're going to go to sleep, that doesn't happen. You have to ease into sleep. Just don't watch too much TV. Kind of like have a ritual. Read a book or your Bible and then hit the bed. Make sure you worry everything outside the bedroom. And then don't bring it to your bed. And then you just kind of ease into it.
My husband always says I'm shutting down the factory, and by goodness, he is asleep in like a minute flat. And I'm like, he can shut down the factory just that quick. And I'm over there, I'm like, da-da-da-da-da-da.
Yes, there are nights, my wife is, she's, the children are up and she's going, and I didn't know anything about it, so.
What can you do about insomnia?
It's a tough, but there are a few things you can do. Make sure you don't drink a lot of Coke, coffee, and all that. Caffeinated beverages, because that's going to make you awake. Make sure you don't exercise later into the evening. Be done with about 6:30.
You don't want those endorphins going wild.
You got that right. And then taking a shower sometimes. When you take a shower, you feel energized, but some people, bath can put them to sleep. So it is a personal choice. And then worrying is, everybody comes and says, I can't turn myself off. I'm constantly worrying. That has to be done outside, you know. And then, of course, like I talked to you about the computers and the phones. People are always on it. The light factor.
Right.
And then make sure your bedroom is comfortable, no noise. And another thing, people always look at the clock. So if you're worrying, it's like 3 o'clock, I have only like an hour to sleep, and you worry. So I tell people to angle the clock so that it's not in your direct vision. And then make sure you have an alarm so you know it's going to. That's what I do in my own life. You know, like I said, your sleep is up and down. You can wake up and then the natural instinct is to look at the clock, and then you're worrying about it.
Yes.
So the more you worry, the more stress you put on it, the more you can't sleep.
So tilt that clock away and just have confidence that your alarm will go
Correct.
off.
Yes.
And just keep sleeping.
Yes. And and because you're going to wake up, nocturnal or nighttime awakening is a common phenomenon in folks. But how do you deal with that?
Yeah, the good thing is I can't see without my contacts across the room to see my clock, so I never know what time it is in the middle of the night when I wake up to look. Is there anything medically that can cause insomnia?
Yeah, all health problems do result. People can't breathe. They have pain. Like diabetics have neuropathy, so that tends to affect their legs. So any medical condition will affect the quality of sleep, and and of course when you have a medical condition, you worry about it, and so that's going to prevent you from sleeping well.
Of the things we've talked about so far tonight, the sleep apnea, the restless leg syndrome, the insomnia, where are the majority of your patients? Where do they fall under all that?
It's about 40, I would say more than, but 60% will be sleep apnea. And then about 20 will be the restless legs and the movement disorder, and another 20% is insomnia. But this is shifting. More people cannot sleep, so more complaints of insomnia. So about 60, 20, 20.
Interesting. Okay, let's talk about snoring.
Great.
Oh boy, if you have a snorer in the family, it can really disrupt not only the snore, it can have implications for them, but the person perhaps sleeping next to them.
Snoring is one of the common causes of the referrals to the sleep center. See, snoring is a mechanism when the air is going through a narrow passage. The vibrations of that passage creates the air is going through a turbulence. So that's snoring. So remember I talked about obstruction, so that there are things obstructing it, and so the snoring gets intense. Men are more snorers. As you grow older, your pharynx, throat kind of relaxes a little bit, so you're more obstructed, and then air is kind of, being turbulent in there. So the incidence of sleep apnea is more common in men than in women.
If you snore, is there a correlation to having sleep apnea, or are they completely different issues?
Very strong correlation. It's a very high likelihood you do. But there are some people who just snore, but they don't have the apnea part. But if you
where
snore,
they stop breathing.
Correct. That's the apnea part. That's the dangerous part. If simple snoring is an issue, it's not a medical problem, but it's just a cosmetic, or it affects the partner. But most of the people who snore do have sleep apnea.
So if they don't, though, if they don't have sleep apnea, what can you do? Can you do anything to make them stop snoring?
You can do those breathe right strips to open the
they
nose.
Work, huh?
Yes, and also you can have a pillow. You can position your head a little bit so that the obstruction doesn't, and then you can wear the regulars, the mouthpiece that over the counter for snoring. But if you have snoring and sleep apnea, that's a totally different ballgame.
Right.
If just the snoring, some people have polyps, nasal polyps, or the deviated nasal septum, and those can be corrected too.
And so that's something you're going to look at when they come into the office.
Yes.
If their nose is off a little bit, or the polyps are
and
in
also one big thing I didn't talk about is the jaw. Some people have the jaw built backwards. The underbite.
Sure.
So that jaw is going and pushing, is squishing the back of the throat. A third of people with sleep apnea do have those issues. So usually sleep apnea is associated with obese folks, but skinny people do have sleep apnea because how the jaw is positioned.
Interesting. Okay, we're going to take another quick break. If you have any questions about sleep disorders, now is the time to call. I'm telling you, 615-737-PLUS is the number to call. Stay with us. We're coming right back.
Mr. Mitchell.
How you doing, Mrs. Bart?
I got a little gift for you.
I appreciate you. Is it over?
It sure is.
Thank you, Jesus.
We can go to the bank together and cash it if you want to.
Yes, sir.
Here at Pruitt's Discount Pharmacy, we want to be a part of your healthcare family. I'm Dr. Sean Pruitt, and let me show you what I mean. We accept every major insurance, but if you're uninsured, we understand. At Pruitt's Discount Pharmacy, we offer lower prices for you so you can afford the medicines that you need. and you don't even have to live nearby. We offer citywide free delivery from Hendersonville to Antioch. Get to know us at Pruitt's Discount Pharmacy. Join our family and
feel good.
That's Pruitt's Discount Pharmacy, the pharmacy choice for the uninsured.
Whether a house is new or whether a house is 20 years old, we can go in and we can find debris in the lines. Mr. B's is about doing duct cleaning the best that we can do it and better than anybody else in the industry. That's what I personally stand behind and guarantee. We never make a claim that we're going to help your health. That's just something we don't do. But again, I personally believe that if I put you in a cleaner environment, it's got to have a positive impact on you. And we literally cut a hole into the main trunk line. That's the main artery, just like a tree trunk. And we attach a HEPA vacuum system to it.
All right.
When we do that and turn it on, it causes a negative airflow. As that machine's sucking everything backwards, we go to each line and we'll brush it, and then we air sweep it down to the trunk line. So we've taken everything back to that negative airflow. So again, whether it's upstairs or downstairs, you saw that everything is being brushed and air swept to the trunk line, not bringing it back into your breathing atmosphere. What makes my home need an air duct cleaning? You have to make that decision. It's your environment. And so if you have black lines at the edge of your carpets, or you have any sort of dust, excess dust in your home that you're dealing with, and that's a problem for you, then you definitely would want your air ducts cleaned. But most people understand too that if they'll just look down the return, take the filter out a little bit and look down the return, they'll see all the dust that they're breathing on an everyday basis. The way we do the cleaning, most residential homes will be good for 5 to 7 years. We do recommend that you have your system serviced by a licensed contractor and also use a good filter. We've been doing this for over 17 years now. We take pride in the fact that we have an A+ rating at the Better Business Bureau. Also the fact that we don't believe that anybody's going to out-clean us. And as I've said before, people can outprice me, but they're not going to out-clean me. There's only one way, and that's the right way, and that's what we do at Mr. B's Air Duct Cleaning.
Sometimes feel you're only halfway ready for the morning? News Channel 5 This Morning makes you feel home. Breaking news, your day planner forecast, and traffic with Sky 5. Get the news you need to take on the whole day. News Channel 5 This Morning.
Welcome back to Medical Monday. We are talking about sleep disorders tonight. We all know that sleep is so precious, and if you're having trouble sleeping, go ahead and give Dr. John a call. He'll help you out tonight. 615-737-PLUS is the number to call. That'll be on the screen up in no time, and we do have some phone lines open, so it is yours for the picking. Go ahead and give us a call. In the meantime, I want to talk to you, Dr. John, about your office and what patients should expect if they're coming in. You have an office, St. Thomas Midtown, also down in Lincoln County. You have a satellite office. If someone is referred to you or they're having trouble sleeping, they're exhausted, and they call and say, I need to come in, what happens first?
So they come in, we have a sleep questionnaire. We just have them fill out what time you go to sleep, how many hours you sleep, what's the quality of the sleep. Are you sleepy in certain circumstances? That's a specific sleep questionnaire called Epworth Sleepiness Scale. And then I see them, and then I have to evaluate them, why they are sleepy. I go through their habits. Are they drinking too much caffeine? Are they not sleeping well? Are they worrying? Is it insomnia? Are they have problems with restless legs? Or is this all, are they quitting breathing? It's usually the partner who tells me the most important. So it's usually the spouse who gives me the clue, and from there I can say, and if it is sleep apnea, I send them to the sleep center. It's on the same floor at our building, and they'll schedule. And during that night, they come and spend the time there. A lot of wires.
Yeah, so tell me about that. Someone comes in for their sleep study. Then what happens?
So they come there around 8:30, and then they bring their favorite pillow. And we have nice, comfortable mattress. And then we'll also study how their brain waves are. So there'll be a lot of electrodes in the scalp. We put them in. We find a way to put them on the scalp, and there'll be belts across the chest to see how you're breathing, and there'll be a finger oxygen, see how your oxygen level. So we have a TV, and you can read, and then there's preferably around 10:30.
Can you move around? Like if I want to sleep on my side and I sleep on my back, and you can do that with all the...
Correct. And there's a cable you can unhook if you want to use the restroom, so you can move. There's a lot of laxity. There's some leeway to do that, and then you fall asleep, and then we wake you up around 5:30, And
That's early.
Yes. Sometimes we'll let them sleep till 6. And, the sleep folks have to finish all their, and then you come back and see me. We go over the results, and we get the results on the next day morning when they leave.
What are you looking for? I mean, I'm sure there are a bunch of charts with lines and everything else. What are you looking for?
The sleep technicians who watch them make them comments. Where they're restless, did they snore? So that we go through that and see how their brain activities is. Did they go through all stages of sleep, the different stages, and then how many times they quit breathing, and how was their oxygen level, how much they move their legs, so we can have an estimate, and then we quantify sleep apnea into mild, medium, and mild, medium, and severe, depending upon how many events they had during the night.
And then you take that information and decide what's the next best step, whether it's CPAP machine or...
If they have severe sleep apnea, we have criteria to put the CPAP on the same night.
Oh, wow.
So sometimes they have to come back.
Sure.
If they meet all the criteria and we have enough time to put the machine on, we try to do that the same night.
Interesting. Okay, let's jump to the phone lines. We have folks on the lines. Fred is calling in. Fred, good evening to you. What's your question?
I just wanted to know where can I go, because I definitely have all of those symptoms.
Okay, Dr. John, where can you go? Tell us how to get a hold of you.
Fred, you've been listening to your symptoms with snoring and tired, so you can call our office. Our office number is 615-284-5098.
Say it again.
615-284-5098.
I got it.
And you can call, and I can make an appointment, and you can see me, and then we can take care of you.
All right, Fred, go ahead and do that first thing tomorrow morning.
Call right now, 284-5098, right?
You can wait till tomorrow to call.
Okay.
Yes, it's probably around 8 o'clock in the morning will be good. Office hours.
Fred, thank you very much. Good luck with that. I hope you get the answers, and they're going to get your information in the back here to make sure that you get hooked up with the right office and everything else. Let's see, we have Jane on the line. Jane, good evening to you. What's your question?
Hi. So I started a new medication that I think is interrupting my sleep. It's giving me really weird dreams. I wondered if I needed to stop taking it.
What kind of medicine is that, Jane?
Singular.
Oh, an asthma medicine?
Yeah, it's for allergy. Usually it shouldn't cause a problem, but if you have bad dreams or you can't sleep?
Just really vivid dreams and just all night long, lots of vivid dreams. So I think it's affecting my quality of sleep.
Yeah, if that's we have other alternatives other than Singular. And the good news is the allergy season is almost over now, so she can try another medicine. So if that's the cause, then you need to stop that. And if you can't sleep well, so you can go ahead and stop and ask your doctor to put you on another medicine other than Singular. There are other alternatives for that.
Okay, Jane, I hope that helps. Hope you'll get back with your doctor and come up with another option, because that's not good when you're not getting good sleep, right?
Yes, exactly.
And lead to other problems. Do you find that with sometimes that it's just a medication people are on?
Yeah, absolutely.
Are there some common culprits?
Blood pressure medicines, especially the medicines that are like beta blockers, propranolol, metoprolol, that can affect your sleep a lot. But that protects your heart, so sometimes it becomes a judgment call. So some medicines like that which have an alternative, like Singular, you can use other medicines, which is easy to switch.
You're also a pulmonologist, which means you work with the lungs and breathing and things like that. How often do those issues overlap with sleep issues?
All the conditions related to asthma and breathing problems do get worse in sleep, because your sympathetic tone is changing. So you have your COPD is worsened, your asthma is worsened. So if you have sleep apnea with your COPD, we call that the overlap syndrome. There's a lot of overlap, and if you're treated for your sleep apnea, you actually improve your breathing, because the CPAP helps you rest your muscles during night, so your breathing actually gets better.
Wow.
So
there is reason to go and get checked out.
Correct.
Things may get better, because some people, when they're feeling bad, they're sleeping bad, they feel sick, there's a loss of hope that things can get better. I'm sure you see that.
Yeah, and you see them back in clinic, and they tell you that you worked a miracle. I mean, they're so excited, and they want to give you a hug and feel better, because then you become a productive person and you can do a lot of things. The lack of energy is a major problem, because your quality of sleep is not good when you have sleep apnea.
And then your quality of life is not
Correct.
good, you know, when you're waking
You're in a bad
hours.
mood all the time.
Yes, nobody likes that. Nobody appreciates that. Probably the people they live with as well.
Exactly.
I'm sure you hear from a lot of happy spouses and partners, right?
Yeah, they're grateful.
Yeah.
And so they're happy.
Let's go back to walk me through the process. We've talked about what happens in the sleep clinic, and then you see all the charts and make the recommendation. Once somebody gets fitted, let's say for a CPAP machine,
okay.
When do they come back and check in with you?
First time you come back to look at the results, it's always better to hear from a provider what the problem is, and then we prescribe the machine. And I typically see them in 6 weeks to 3 months. So they can come back and see how they are doing. The follow-up is important because it could be a small thing which we can, correct so that they wear the mask. And we always tell them to bring, the chip. Sometimes it's online. You can go through the website and see how they're using the machine. So then we can say, is it effectively treated the condition, or do they have other problems with it? And then we can change the machine pressure. We can go from a CPAP to a BiPAP. Or other modes of therapy.
What's a CPAP and a BiPAP? What's the difference?
BiPAP is 2 forms of pressure. There's a pressure going in and pressure going out. Sometimes the CPAP is continuous, so sometimes patients have difficulty breathing out. With a BiPAP, they get a little bit of a break, so the tolerance. My father-in-law had a difficult time with CPAP. I switched him to BiPAP, and he can't sleep without it. So
and now you're best son-in-law in the world, right?
I'd have to ask my wife on that one.
The truth comes out. It's good that you can help them nonetheless.
Yes, you can. That could be a simple thing.
Sure.
We check that in our follow-up.
Okay. What else do you notice on those follow-ups? Any changes, other changes? Or?
If they had, a lot of apneas, and this will tell me how much the apneas have come down. Sometimes they still have apnea, so we can dial up the pressure. Is there any leaks? The mask is leaking.
So it's a tight fit.
Correct. And most important thing, are they telling me the truth? Are they wearing it? So
you can check up on it.
Exactly. And they're using it for at least 4 hours a night. So all this data is on that little SD card they bring to.
I like that. It's kind of like, going to the school teacher and be like, I really didn't do my homework, or I didn't do my homework.
For if women are more compliant than men.
I'm not surprised by this.
Men, we have to work with them, and they do. They do if you talk to them. That's what the importance of follow-up. If you work with them and find out the problems, they do improve the compliance.
Overall, let's just go back to where we started at the very beginning. If people have tuned in a little bit later, sleep in general, how much should we be getting?
Sleep is needed. It's like I tell people, it's like turning off the computer. The computer's going all day, and then you need to turn it off, and it's like rebooting.
Yeah, because what does our body do when we're sleeping? What happens?
Your heart rate goes down, your breathing goes down, so you're in a there's not much difference between sleep and death.
Oh, that doesn't sound good.
You don't wake up, you're dead.
Right,
so you are in a state of complete relaxation, which is much needed. So your brain gets rest, your heart is resting, your lungs, and of course you dream and you resolve all the problems. So it is an important thing. The number of hours depends on each person. Some need a little bit more sleep than the others. So
when people say I can sleep 4 hours and I'm fine, that's true.
That's true. There are some people who are short sleepers, and they feel fine with 4 hours. That's fine. We don't mess with it.
God bless them.
Yes.
Not me.
Yeah, some people do. Usually they're high achievers.
Oh, well, thanks.
So it doesn't matter. So a little bit more sleep is okay.
That's okay too. Very good. I got you. Okay, we're going to take a quick break. When we come back, get your pen and paper ready. We're going to tell you how to get a hold of Dr. John if you would like to make an appointment. If you're not sleeping well, we'll get you on the road to getting that fixed. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Hi, everyone. I'm Storm 5 meteorologist Leland Statham. This afternoon, a mix of sun and clouds around the area with temperatures warming up into the mid to upper 70s. But late in the day, more clouds begin to roll in, so more of a mostly cloudy sky for the big Preds party on the plaza this evening. Here's a look at the temperatures for you at this hour, and here's what's happening right now from Nashville International. Your Monday forecast, high just shy of 80 degrees for you today with a wind north-northeast at about 5 to 10. Now at 5 p.m., look for a temp right around 77 when the puck drops in Smashville tonight. Look for a mostly cloudy sky and right around 71 degrees. Some of our southern counties could see rain tonight. Most of us dry. Rain chance tomorrow, greater chance in the eastern counties than the best chance of rain Tuesday night into Wednesday.
I don't pay too much attention to politics, but it keeps popping up when I'm trying to watch my cat videos.
Next new Ellen from House of Cards, Robin Wright, plus Nicki Minaj.
Look at you all covered up. Don't start. All right.
Nicki put Ellen in her new music video.
I've never been a part of a rap feud before. Do I have to do anything? I don't know. Part of a feud now.
Tomorrow at 3 on News Channel 5.
As a mother, you don't want to have to worry about this bill is coming, but then she needs this chemo. That's a decision you shouldn't have to make.
At St. Jude, a family never sees a bill at all, not one bill. It's like the world has been lifted off of your shoulders.
The treatment doesn't get any better than what you receive at St. Jude. It saved my life. It saved my daughter's life. It saved our family.
Welcome back to Medical Monday. If you would like to get a hold of Dr. John, here's how to do it. A couple of different ways. Medical Mondays at ouradvancedhealth.com. Check that out. You can call the referral line, 615-986-6033. Tell them you want to talk to Dr. John. They'll get you hooked up and to the right office. And you can also go to advancedhealthmedicalmondays.com. I hope that helps you out. As we talk to Dr. John and wrap things up, just some final words of advice for people who are looking to get better sleep. Maybe they don't have a sleep disorder, they just want more quality sleep.
Yes. The first important thing is not to worry too much about sleep. If you put too much pressure, obviously, you're not going to sleep. Have a strict schedule. You have to go to bed around 10:30, wake up at 6, whatever. So that's important. And all the bad habits of watching, your phone should be away from your bedroom. People are always on the phone. The light makes you awake. And then make sure you don't drink a lot of Coke and coffee before you go to bed. And then always remember, sleep is a dimmer, you have to have a ritual to go to sleep.
Okay.
And then it's not like an on and off switch. You can't do this and then hit the bed and expect. And then if you're snoring and you're tired, and then if you're moving your legs a lot, and those are, and your spouse is saying you're quitting breathing and you don't feel better the next day, then you have other conditions, then talk to your doctor, and then you can get help. And then rule out the secondary causes for sleep.
Reach out. Don't just continue on that same path because it can get serious. Dr. John, thank you for the education today. I've appreciated it. It's been very interesting. I've learned a lot. I hope you have as well. Reach out to Dr. John if you need to and get some better sleep. In the meantime, have a great week.